Hello, everybody. Welcome to TheLine.Info. Today, we're launching something brand new here at TheLine.Info. It's a series dedicated entirely to healthcare topics that impact you and your community. It's called Healthcare Corner, and I'm joined by Dr. Joseph Arrington, who will be the host of this new series. Dr. Arrington, it's great to have you here introducing this exciting new program.
It's my pleasure to be here. Very excited for this new endeavor. It's going to be very fun.
Great, great. So, for our viewers meeting you for the first time, what can you tell us about your background and your experience in healthcare?
Yeah, definitely. Toward the end of my undergraduate career at the University of Utah, I decided that I wanted to become a physician. Along the way, I had some different experiences, both in class and a part of one research team that I was on, that also got me very interested in hospital and healthcare operations and administration, and how what happens from that angle directly affects I guess indirectly affects the outcomes that patients have in their care. And so I had that kind of dual, not quite conflicting, but dual interests going on. So after I graduated, throughout my undergrad, I was not a pre-medical student. So I needed to go through all the different things that medical schools look for. And I didn't have that upon graduation. So I decided to work on those things while pursuing that other passion of mine, looking into how hospitals and healthcare works from the business administration, operations side of things. And so I went and I did an MBA. I went to Westminster University here in Salt Lake City. Fantastic education, fantastic program. It was really great, really eye opening. During that time, I focused a bit on technology commercialization, invented a medical device with a team of bioengineers that I recruited to help underserved communities in sleep medicine with sleep paralysis, sleepwalking, and similar sleeping disorders, parasomnias. And we worked on that for a few years while I finished my MBA. I started my doctorate of business administration around that time as well, a little bit later. And we won a lot of different awards. It was a really great opportunity. We ended up getting the device patented, and we're still working on it to this day. We're all fractional executives in the company since we all kind of diverged out into our career pathways, but we still have a lot of faith and a lot of love for that medical device. So in the background, it's still percolating. We're working on it. But in the meantime, I continued being part of research and working on that. And one thing led to another. And I am currently in my third year of a joint medical doctorate PhD training program. I'm at both the University of Utah School of Medicine and Nordicom here in Utah. So doing that joint dual training so that I can combine the scientific aspect of healthcare and understanding how it all works with the direct clinical care to helping patients. And the end goal is to be a little bit of a kind of a Swiss Army knife in medicine with a lot of different tools at my disposal to help improve patient care both directly and indirectly. And yeah, it's been a really fun journey so far.
All right. So, I want to talk a little bit about because your title is Dr. Arrington. So, what exactly is your doctorate in? And while you're at it, could you also explain for our audience what the difference between a physician with the title of doctor is and everyone else who has that title as well?
I am so glad that you asked that. So, what I like to, when I was first explaining it to my kids, how I explained it was every physician is a doctor, but not every doctor is a physician. So, somebody who gets either a doctor of osteopathic medicine or a doctor of medicine, so DO or MD, they have the opportunity to take board certifying exams. If they pass those and they go through a kind of a internship period called a residency, they become physicians. If they go through medical school and they don't do that, they are medical doctors, but not physicians. Physicians are people who directly care for and are licensed and certified. I mean, licensed and or certified, but most of the time it's certified as well, to treat patients directly. And they go through the standardized process. It doesn't matter what country, what state, it doesn't matter where they got their medical doctorate. If they go through the US licensing and credentialing process, they are credentialed and shown to have the capacity to know how to treat patients. And so that's a physician. Whereas a medical doctor is somebody who went through the process, got a doctoral degree level of education in medicine, but they don't practice, which there's nothing wrong with that. It's just a different pathway. Um, yeah, and so we have that similarity with other fields as well. My current doctorate is a doctorate of business administration that I received from Drexel University's LeBeau College of Business. And so that shows that I have a doctoral level of training and understanding within business. My specialty, what I focused in on, was healthcare administration and organizational behaviors directly toward physicians, funny enough. And so with the DBA, that is in the same vein of doctoral degree. It's called a professional doctorate. As a JD, which is what attorneys slash lawyers have, MDDO, which is what a physician has, or an EdD, a doctor of education, PsyD, PharmD, all of these are professional doctorates that don't necessarily have a research component to it. Mine did. Mine was I chose it because it was a hybrid between professional and research doctorate, but in the end, it's still a professional doctorate, and it's to help not only show that somebody has a doctoral level of understanding, but also to help them directly engage in the field that they're going to go into. Whereas on the flip side, you have the PhD and the DPhil. Other countries, especially in Europe, call it that. These are research doctorates that are geared specifically toward people who want to dive into their field and help create novel ideas and brand new theories and whatnot to help promote the field. On In real life, it's not as straightforward and cut as I'm saying, but on paper, how it generally is supposed to work are the researchers. And you don't have to have a PhD to be a researcher, but I mean, the PhD gives you specialized training to help you have more tools in your research. So the PhD allows for those people to dive in and create and generate novel ideas. And then on paper, those ideas are then transferred to people like the MDs, the DOs, the DBAs, the EdDs, and whatnot, to take that uh, the new theories and the new ideas with a doctoral level understanding and translate it to in vivo, real life actions in living, breathing organizations. And so that's where I come from. I'm a practitioner of business administration. That's where my doctorate is, and I'm currently in my program's probably going to be 6 to 7 years long. And so I'm in year 3 of the joint PhD and medical doctoral training that I'm going through, so that I'll be a hybrid of all of those ideas.
So tell me, what originally sparked your interest in this field?
Originally, it was from when I was younger, about 11 years old. We noticed that I was gaining a lot of weight. And I was actually exercising quite a bit. I went through some old like journal entries and whatnot that I had, and I was exercising a lot, and I was not losing weight. And we went to my physician, my pediatrician, and we saw that I had something called hypothyroidism. I didn't understand all of the mechanisms behind it at the time, but long story short, there was something in my metabolism that wasn't working the way it was supposed to. And so calories were not being distributed the way they're supposed to. And then when they were finally stored in my body to get it to be used, took a lot more effort than normal. And with my particular situation, anybody who's listening to this, they'll like, oh my heavens, I don't remember the like micrograms or whatever it is, nanograms, whatever it is, but I was at 330 for my TSH count, which is extremely high. I believe the modern current frame of reference is zero point 0.8 to 8, and I was at 330. That just meant that my body was trying to yell at my thyroid to say, "Hey, wake up! You got to work," and it was just sitting there. The medical team at the time even remarked at three different people that day remark, "I'm surprised that you're even conscious and talking to me. I mean, I would expect you to be some kind of zombified corpse right now." And one person remarked that they were surprised it didn't have a massive goiter. Um, and yeah, so it was that was what originally I guess it fueled my interest in medicine. Uh, for science in general, it was my sleep paralysis issues. I was waking up. My body was paralyzed. I wasn't able to move. And at a very young age, I was interested in creating a device, creating some sort of a machine. I called it a robot when I was a kid. I wanted to create a robot that would help wake me up and pull me out of the nightmare that sleep paralysis causes. But and the reason I mentioned the distinction is because science isn't necessarily medicine. They are two different things. Medicine is more about the art of directly treating patients and helping them, whereas science is more about measuring what is happening in the STEM field. And it includes things like engineering and trying to take what we know and translate it into something that can help people. So my interest in science started from sleep paralysis. My interest in medicine started with my own struggles with hypothyroidism. And it actually took a few years after that for them to figure out my levels and get it locked in. And once they did, I remember I lost a lot of weight after high school. And that was around the time they locked in, and I started becoming more athletic. I mean, I was athletic all through high school, but I was never able to reach my potential because my body wouldn't allow me to. So I'd be lifting weights every day, running every day, but my body was not creating any muscle mass until after high school when the medical team helped me and honed things in, which was, I was so grateful for it. And I thought, I want to do that for someone else. I want to be able to help them. I mean, they didn't sit down with me. They didn't force me to exercise and get healthy afterward. That's on the patient's end. But to give people the opportunity to have the tools at their disposal and counsel them. So, and with the word counsel, I feel like the ultimate form of being able to counsel with people and help coach them and advise them is through being a physician for me, and that's one of the really big draws that I wanted to do that. However, I started college. I met a wonderful young lady that I fell in love with fairly quickly, and it was during my freshman year of college, and we got married nearly a year later, and about 7, 8 months later, and then I. I was very scared of the medical training pathway, so I didn't. I quit in my freshman year, and I didn't want to continue moving forward with that because I thought it was going to be too much work. So I ended up. I was split between becoming a sports coach and a psychologist. That was what my fallback options were. I was still interested in those domains, so I went through all of college from that point forward, focused on that. And then toward the end of my senior year, I had a good research team opportunity that it it drew me back in, and I couldn't fight it. And that desire was there. I was working alongside physicians, loved what they were doing. I loved the notion that there's a thing called a physician scientist. So they do both, and the rest was history after that point.
So let's dive right into this new series that you will be hosting. It's called Healthcare Corner. The first thing I want to ask is, what do you want uh, this new series to bring to our viewers that that they may not be getting from other sources?
Demystify healthcare. I mean, we got some fantastic influencers and journalists and whatnot out there. The first one that comes to mind is Dr. Mike. He's a physician. A lot of people know him. I probably don't even have to explain who he is, but so he goes and he demystifies a lot of stuff surrounding medicine and whatnot. But with healthcare itself, I feel like there's still a lot of things going on that people don't quite understand, whether it is insurance, whether it is speaking to physicians, whether it is trying to understand why you might have gotten a test result and it took so long to get to you. It's and then people end up, oh, that physician, that doctor, oh, it probably isn't the physician's fault. There's a whole bunch of different dynamics. One thing that I think that is so fascinating to look at is the fact that we like to call new things in medicine, like novel treatments, novel procedures, and whatnot, innovations. The current literature indicates that on average, it takes 17 years from conception until it is adopted by a physician. And a lot of people don't know that. And so they might hear, like, oh, but I heard there was some new procedure out so and so, and somebody did it. And why doesn't my physician do it? And then some people might say, oh, bad physician, bad doctor, how dare you not know about it? It's from the research I've been doing, it's not their fault. It's a part of the system and it's baked in, and you can't be pointing fingers. Well, you shouldn't be pointing fingers. And so it's things like that. It's these different facets of healthcare that affect us in the end in our day-to-day lives, and affects how we interact with medicine and how fast we can get the treatment that we need, and why there seems to be roadblocks here or there. And so things like that just kind of demystify the whole process. And I think it's going to be I think it's going to be fun.
So you talk about demystification. What are some things that, for want of a better way of saying it, they kind of muddy up the view of the healthcare industry or maybe even healthcare procedure?
Yeah. So um, one aspect of it is how we have it's very reductive, but just to set the stage, you can look at it initially as two different tribes. Dr. Emir Casey talks about this in a recent, semi recent paper that he wrote, but two different tribes that exist in healthcare. We have the clinicians who are helping patients directly in how they were trained. You have your physicians, your nurses, your physician's assistants, the nurse practitioners, and so on and so forth, the techs and all that. They all trained in one way to help the patient and make sure that the patient is treated and well and able to move forward. On the other end, with basically the same goal, you have the administration, the business people, the managers. Uh, like I said, basically the same goal, but they're trained in a completely different way to get there. So they come at it from a different, like a return on investment, finances, accounting, administration, and being able to lead the team and make sure that the team is happy, this, that, and the other, while still making sure that their relationships maybe with vendors are intact. Maybe a brand new thing is invented, and some physicians are really excited about bringing it into the practice, but it conflicts with a contract with another distributor. And so, regardless of people wanting it, and like I said, this is a very simplified overview, reduced version of it, but just to get a little bit of that idea of things that are going on. So you also have things like credentialing. Uh, you have other items of education. You have some people who trained in other countries and they were full-fledged physicians. It reminds me of that really funny scene from The Office where the guy said, "In Japan, I was the best surgeon, never made any mistakes. but he's not a physician here. He's not a surgeon here in the US, not because he is not the best surgeon in the world, but because of credentialing. And so sometimes, and I know stories of this, I've seen it happen, that people who are physicians from other countries come here and then they become medical assistants or scribes while they are waiting for the process to allow them to practice. And so, I mean, just little things here and there, they you can isolate them and silo them and say, okay, that's happening here, that's happening here. But if you turn it into a healthcare mosaic, you could say, you can see how they flow in and out of each other and end up affecting the grand scheme of things. And I just think it'd be really interesting and fun to discuss that with you all out there in the internet land.
So, what kind of topics can viewers expect to see covered in upcoming episodes?
Yeah, so some topics that I would like to cover through this non exhaustive, talking about new medical procedures, technologies, all those innovations I talked about, dive a little bit deeper into why it takes so long to get to patients and how that affects us. Uh, I mean, something that we saw really come to a head was recently in the COVID-19 pandemic. The clinician burnout we had. I mean, I was a member of my local Rotary Club during that time, and we got word that our local hospital, we live in a rural county. I think it's still labeled as medically underserved officially by the government. And they were so overworked. And we felt so bad for them. We found out that we were a part of that enclave of issues happening wherein nurses were quitting in droves because they couldn't take it anymore. It was too much work. And so, like, diving into all the different aspects of what leads to nurses, physicians, PAs, and whatnot, feeling that burnout. Another thing that I think would be really fun to talk about is our personal information. How safe is HIPAA, and how safe is our personal information when we are divulging that stuff to our teams and whatnot? Talk about the relation, like I mentioned before, the relationship between clinicians and the administrative team. And I've mentioned this a few times, but sometimes it gets confusing. What actually is the difference between a nurse, a physician assistant, a tech, all these, an assistant? So I think that'd be cool to dive into, like private practices. Why do they exist? Diving into some things with the legislature. I mean, I am a physician in training, so I'm never going to be going out and saying you should do this. Well, there are some things I can say. I am a certified personal trainer and a certified nutrition coach. So there are some things that I will always make sure to vet everything I say, so that yes, there will be advice from many different facets, but always with a disclaimer on what is professional versus just an anecdote from a layman who happens to be training but cannot officially say certain things.
Before we go, what message do you want to leave with our audience as we kick off Healthcare Corner?
About a decade ago, uh, we were a little over a decade ago, we were in the throes of transitioning from what we had before for healthcare being administered to us here in the United States, transitioning over to Obamacare. And it seems a little weird now to think back at that because uh, it's so commonplace now. But I remember that transition, and it was around the time that I was starting to think, hey, I think I'm going to go back into medicine. It was on that research team, and one of the directors of a department there had a special meeting with our team, um, talking to us about these transitions and what was going to change. And one of the things he said was, from a completely non-political point of view, are there things about Obamacare that I like more than what we've had up to this point? 100% yes. Are there some things about Obamacare that I think was better in the previous version of what we had? Yes, I do. But those things cannot coincide with each other. When you start a new program, there's going to be a give and take. But we're learning, and the point of all of this that we're trying to do to make healthcare accessible to people uh, is partially a learning process. We Everyone who's in healthcare are supposed to be doing their best because we want to help. That's my perspective. We Mistakes happen. Uh, there are things that I do not agree uh, with both the current administration, the previous, and the previous, and the previous, and I'm sure that in the future administrations, how things are happening, there's going to be things I agree with and disagree with. And what we have to do is try to figure out how to evolve into that next step. I don't think that humanity is ever going to find the perfect utopia of healthcare, but we can get close. And there's going to be a lot of trial and error. The way I see this kind of evolution is that we had titans who established the initial. I mean, a lot of people say that Moses was the first physician with what he did, and then on his shoulders we had other people build up, and now we have our current healthcare system. And then this generation is going to make policies and make things better. The next generation will be standing on our shoulders, and we will continue to lift them up. And so, in this journey that we're all in, trying to both, for people like myself, trying to make healthcare better, and for all of us who have to deal with healthcare, whether for the good or the bad, my message is don't give up hope. Sometimes things are frustrating. Sometimes we don't understand why things are the way they are, but we are trying our best to make things as good as they can be. And I hope that the healthcare corner can be a nice little place to visit, to vent some frustrations in the comments section if you have them. I will do my best to answer as many as I can and address some of the more popular ones in future videos. And we can all learn from each other together the best ways to interact with healthcare and why some things are happening the way they are. Because there is no perfect system. There's always going to be the good and the bad, and we have to figure out how to take advantage of the good and minimize the negative effects of the bad.
Well, folks, there you have it. Dr. Arrington, welcome to the team here at TheLine.Info. From here on out, this is your corner to explore and share with our viewers. We'll be waiting to see what fascinating new things you'll be sharing with us. And for all of you, I urge you to watch the Healthcare Corner.